High-frequency ultrasound, or HIFU for short, is the use of sound waves to generate heat. Coupled with imaging and computerized targeting, you can effectively treat lesions deep within the body without any damage to the surrounding tissues. Unlike when you beam radiotherapy through the body tissues, there's a risk of collateral damage related to the use of radiological approaches. Specifically in prostate cancer, the HIFU, or high-intensity focused ultrasound, has evolved into a treatment used for treating single or maybe up to 2 lesions within the prostate, where the prostate cancer is localized to a single area, which means that there is much less risk associated with the procedure. Originally, when I started the use of HIFU, we were doing whole gland treatments, and when I first researched it in the early 90s, we were using it for benign prostatic hypertrophy, or benign enlargement of the prostate, and it was effective in that setting. But now it has evolved almost exclusively for the treatment of focal prostate cancer lesions. In terms of prostate cancer, it is a very varied disease, from relatively indolent to very aggressive. For those men who have intermediate risk disease to higher risk disease that is confined to a single area in the prostate, focal therapy offers a low impact treatment which has much less side effects that are associated with whole gland treatment, whether it's robotic keyhole surgery or radical radiotherapy, namely the risk of sexual or erectile dysfunction, which is high in terms of standard treatment modalities, as high as 50 to 100%. Focal therapy, on the other hand, has a much less risk of erectile dysfunction, less than 5%, affording particularly the younger patients the opportunity of not risking sexual function whilst they are clearly young enough to enjoy a normal sex life, as opposed to having radical treatment, which would effectively render them impotent. The other advantage of focal therapy is, because there's no cutting of the tissue, trauma in terms of removal of tissue, and no associated damage from external radiation caused when you use radiotherapy techniques, the recovery is very quick, and the risk of urinary incontinence, which can be significant with surgery and radiotherapy, is almost negligible with a focal HIFU approach. One of the advantages of focal HIFU is that it can be performed as a day case procedure. Patients are discharged the same day of surgery and really get back to normal activities within weeks as opposed to months, which is usually the case when you are treated either with radiotherapy or with radical surgery, including robotic surgery. So the recovery is much quicker, and the recovery to normal activities, including sexual function, is much quicker, and there is much less risk of long-term problems. The ideal candidate for focal HIFU is a focal lesion. That is a lesion within the prostate, single focus that can be identified by MRI, and therefore the follow-up in terms of knowing whether the lesion has been destroyed can be identified through MRI imaging. It also should be a lesion that is likely to progress with time, but it's not very aggressive, because more radical treatments are more appropriate for very aggressive disease. And for low-grade disease, then simple active surveillance remains a very sensible option for patients. So it's for intermediate to higher risk disease with a single focus in men who are particularly concerned about the side effect profile of radical treatment, sexual dysfunction and/or incontinence, where this treatment offers a good alternative to the standard treatments. If the lesion or focal lesion within the prostate is outside the attenuation distance of HIFU, we do have other modalities such as transperineal laser ablation, electrophoresis, cryotherapy to treat more anterior lesions. The majority of lesions are within the scope of HIFU. And for more aggressive disease or widespread disease that is contained in the prostate, we have the alternatives of radical robotic prostatectomy, as well as radiation techniques ranging from seed implant brachytherapy to external beam radiotherapy.